Union Health Ministry has said that extensive studies by ICMR and AIIMS have conclusively established no linkages between coronavirus vaccines and the recent sudden deaths among young adults in the country. According to the ministry, the Indian Council of Medical Research and the National Centre for Disease Control have affirmed that COVID-19 vaccines in India are safe and effective with extremely rare instances of serious side effects. To explore the cause of sudden deaths in adults aged between 18 and 45 years, two complementary studies were undertaken using different research approaches, one based on past data and another involving real-time investigation. The first study was carried out from May to August 2023 across 47 tertiary care hospitals in 19 states and union territories. It looked at individuals who appeared to be healthy but died suddenly between October 2021 and March 2023. According to the Union Ministry of Health, the study findings conclusively showed no linkages between the deaths and the COVID-19 vaccine.
This study was done in the aftermath of COVID-19 pandemic. There were news reports apparently linking death of healthy young individuals all of a sudden without any medical reasons, unknown medical reasons. These reports were allegedly linking these deaths with COVID-19 in terms of either suffering from COVID-19 or vaccination for COVID-19. So therefore, our study was done in order to answer the question on what could be the reasons why suddenly young individuals are dying all of a sudden. ICMR did commission this study, and it was led by us in collaboration with medical specialists and researchers from across 47 hospitals in India. We did a huge study comparing 729 individuals who died all of a sudden despite being in good health just before death. And then we compared them with almost 3,000 apparently healthy alive individuals who are of the similar age, gender, and living in the same locality as their other individual.
A second ongoing study by AIIMS New Delhi, funded by ICMR, is also investigating sudden deaths in young adults. Early findings confirm that heart attacks remain the leading cause, with no significant shift in patterns from previous years. Researchers have identified genetic mutations in many cases. The Health Ministry warns that unverified claims about vaccine risks could undermine public trust in immunization.
The other factors such as family history of sudden death, past hospitalization for COVID-19, and heavy drinking or intense exercise just before death were the only factors that were associated with unexplained sudden deaths as compared to people who are alive. So it's a statistical analysis which led to the conclusion of these risk factors being responsible for sudden death and not COVID-19 vaccination.
The clarification comes after a political controversy in Karnataka, where Chief Minister Siddaramaiah linked a series of heart attack deaths in Hassan district to the COVID vaccine rollout. He cited over 20 deaths in just one district, including among youth, and called for urgent medical monitoring. The state has formed an expert committee to probe the cause of the deaths and submit findings in 10 days.
The public should rely on credible sources, such as, for example, Ministry of Health and Family Welfare, state immunization officers, or their own physicians. They should not be misled by unsubstantiated claims and reports in the media. They can always consult a reliable medical source in the neighborhood for such information and need not worry about information that is coming from all the other not so credible sources.
The Union Health Ministry dismissed the vaccine link, calling such statements false and misleading. It said vaccine safety has been scientifically validated and COVID vaccines have saved millions of lives. Experts warn that speculative political claims could trigger vaccine hesitancy and damage India's public health efforts.